So I'm going to do an assessment on the head and face and also a brief neurological exam. And I've washed my hands and I'm ready to go. So when I'm doing a head assessment, I'm checking the size, shape, and midline position. Throughout my exam, I'm looking at the skin. I'm looking for, specifically for bruising, color, scars, lesions, nevi, any moisture or edema, and the temperature, texture, and turgor of the skin. So I'm going to start by palpating. While I'm palpating, I'm also looking. I'm looking for any infestations, any masses, depressions, or areas of tenderness. I'm going to feel here for any temporal tenderness. And while I have my hands on her face, I'm going to go ahead and start observing cranial nerve number 5. So I'm going to have you clench your jaw, please, and move it from side to side. Very good. Another function of cranial nerve 5 is sensation, facial sensation. So this is my little swab, and we'll say that this is the dull end and this is the sharp end. Okay, feels kind of like this for dull and this for sharp. Okay, so I'm going to have you close your eyes. I will touch your face in various places and just tell me if it feels dull or sharp. So we're checking to see if her sensory perception is accurate. So, dull. Sharp. Good. Sharp. Dull. Do that one again. Sharp. Sharp. Good. While I'm here, I'm going to go ahead and I'm going to test cranial nerve number 11. So I'm going to have you pull your shoulders up against resistance. Good. And I'm going to have you turn your head against resistance and towards my hand. Very good. And do it this way. Excellent. I'm going to go ahead and palpate the lymph nodes. When I palpate the lymph nodes, I'm going to kind of go in a circuit. It works for me to remember them. So I'm going to go with the pre-auricular, which are in front of the ears. I'm going to do the post-auricular, which are behind the ears. I'm feeling with the pads of my fingertip, and I'm going to feel the occipital. Can you put your head down just a little? The occipital are at the base of the skull. The tonsillar are here. The submandibular underneath the jawline. Usually you will feel more than one in a grouping. On the submental, I'm going to put just a little pressure on the top of her head and feel it underneath. And then I'm going to go straight to the supraclavicular. We're about midway between the shoulder and the sternum. There's cervical nodes here, and post-cervical nodes are lower. And throughout the midline of the neck, on the muscle processes, there's a cervical chain of lymph nodes. They're pretty deep, and you're not normally going to be able to palpate them. But when I'm doing the lymph node palpation, I'm looking for nodules, masses, any areas of tenderness, or any other irregularities. So I'm going to go ahead and palpate that area anyways. I'm not going to just skip over it because it's unlikely that I'll feel anything. Okay. Anything tender there? Nope. Okay, good. So we'll do cranial nerve number 7, which will have you make faces at me because it's testing facial muscles and control. So I'll have you raise your eyebrows. Good. And then you can smile. And then frown. Good. That's a good frown. Puff out your cheeks. Very good. And then purse your lips.
It does get
good.
crazy.
Okay. For cranial nerve number 12, we're going to have you stick out your tongue. When you stick out your tongue for cranial nerve 12, I'm just looking for midline protrusion and lack of fasciculations. If it deviated, I'd be concerned. So go ahead and stick out your tongue, please. Great. Midline protrusion. Excellent. The next one is for 9 and 10, and it's actually another one where I have her open her mouth. 9 and 10, you're going to notice that the soft palate and the uvula raise symmetrically, and they're not going to deviate either. So I'm going to go ahead and have you open your mouth and say ah. Good. And she had consistent phonation, so another thing with the cranial nerves, I mean, she's speaking to me, she's able to swallow her own secretions. I know things are looking good, but these are specific exams to look at different ones. Let's see, where am I at? We will go ahead and do the hearing one. It's for cranial nerve number 8. And first I'm just going to, I'm going to go behind the bed. And you just stay where you're at. Okay, so we're going to start with this ear.
12W7.
Great. I'm going to do this one.
13X5.
Great. Okay, I'm going to come around with that again. And we're going to do the Weber, which is done with a tuning fork. Hopefully this one works better than the other one I had used. So I'm going to strike the tuning fork and then put it right here on your forehead. This tests for unilateral hearing loss. So ideally you're going to hear the noise in both ears. If you don't, then we would suspect maybe some hearing loss. Okay?
Yes.
Okay, very good. This is a better tuning fork. Okay. The next one is the Brine or the Rene. I think it's called Brine. And this one actually tests for conductive hearing loss. I'll strike the tuning fork, I'll put it behind your ear, and then I'll hold it here. And you tell me which way you hear better. Do you hear it better when it's touching you or when it's up by your head? Okay?
Up.
And I'm going to do that again with this side, okay?
Up.
Okay. And that is a normal finding because air conduction is greater than bone conduction. So you're going to hear the vibrations in the air better. And the next one is for cranial nerve 2. And we're going to do a gross visual exam. So I'm just going to have you stand right here. And we'll continue filming where you're at. And I'm going to just hold up fingers. How many do I have?
2.
Great. And can you see the clockwork on the wall?
Yes, I can.
What does it say?
It says 1500.
All right. So now we're going to do one that tests your peripheral vision. So I'll have you just look at my nose.
Okay.
And I'm going to bring my arms in when you get a little closer. I'm sorry.
Okay.
When I bring them in and you see my fingertips, would you just say now?
Now.
Great. And this other one is very similar. It's the wiggle test. And I'm going to hold my fingers up. And you just say which direction you see them wiggling.
Which is
Like, is it to your left or to your right?
oh, I see. To my right.
Okay.
To my left. To my right. To my left.
Perfect. Okay. So go ahead and have a seat. Get my pen light. With that one, I was looking just to see with the finger pointing one, I was hoping that she would see the fingers the same time I saw them, like a typical peripheral vision. And then the wiggle one, of course, the same thing. So I'm going to do number 2 and I'm going to actually do I'm sorry, we just did number 2. We're going to do number 3, 4, and 6. And so I'm going to do some pupillary responses. This pen light will work. There you go. Okay, and so what I'm looking for is that the pupil will respond to the light. So a direct response, but also the other eye that's not being directly shined on is going to have a consensual response, okay? Great. Do the same thing. Great. Good responses. I'm going to have you look over here. And with that, I'm looking for nystagmus, for which I see none. I'm going to have you follow my pin light, the tip of my pin light. I'm just going to move it around. Very good. Now I'm going to bring it, sorry, one more time. I'm going to bring it towards your nose. Good. So with that, for 3, 4, and 6, I'm looking at her ability for her extraocular movement to um, follow the tip smoothly, for her muscles to be working smoothly together. Also, again, no nystagmus. When I bring the light the tip towards her nose, I'm watching her eyes accommodate for that, for seeing distance and then seeing up close, and everything looks normal there. So the last one is number 1, cranial nerve number 1, which is sense of smell, and I'm going to have you close your eyes, and I will bring over something for you to sniff, and we'll close one nostril and have you tell me what you think it is, and then we'll do the other side, okay? Close your eyes. Start with the left nostril.
Coffee.
Keep those closed. We have one more odor for you. I'm going to try the right nostril.
Lemon.
Yep, we got some lemon there. And I thank you for your time, and I think that sums it up.